Hi, my name is Bina Ayad. A student of Masters of Public Health. Present to you today a very important topic: Flint water lead poisoning crisis. We wanna assess the community health needs of for Flint regarding this problem. Okay, so let's talk a little bit about the Flint crisis. Let's know Flint a little bit. What city is Flint? So Flint is a Detroit metropolitan city in Michigan, and it became a media topic since the water lead poisoning crisis. And the case is now considered an environmental injustice case as a result of the unexplained problem negligence. As we can see later on, nearly half of the people are African Americans. So and that's a case of environmental injustice. The Flint crisis started in April 2014 when the water supply changed to originate from Flint River temporarily instead of the permanent supply from the Lake Huron, and people started noticing a change in color, taste, and odor of water. So, in order to better assess the community health needs, there are three logic models: proceed, map, and map it. I chose map it. I'll tell you why in a little bit. Map it. M stands for mobilization, through gathering organizations that have initiatives to correct the current fatal water lead poisoning in Flint, Michigan. Assessing through evaluating Flint residents' need for lead poisoning, early detection, and emergency temporary correction measures. Planning and implementing through creation and execution of a plan for fighting lead poisoning that matches the goals of Healthy People 2020. Tracking progress through periodic blood and water lead checks as a follow-up after reaching the project's goals. So mapping has a lot of advantages. What are the advantages? Provides clear action plan, can be monitored, support Healthy People 2020 goals as disease prevention, offering medical care to all Americans, and adopting healthy lifestyles. Provides documents, links through Map It website. What are the disadvantages? There are no formal assessments. Let's talk a little bit about physical environment and context of the Flint water crisis. So blood lead levels were measured before 2013 and after 2015. We focus on a certain age group. Is children under 5 years. They are more prone to central nervous system permanent complications than others. So the results were amazing. That were shocking. Blood lead levels incidence increased from 2.4 to 4.9%. That's nearly half, reaching nearly double the percentage of lead poisoning, and that's interesting. I'm sorry, reaching a peak of 6.6% increase. Results of wind shielding and walking surveys I did. So the author interviewed a coworker. This Flint resident completely denied the problem. Any further questions regarding context of the problem, community manifestations of the problem, causes, and possible consequences were not answered. That's an opposing opinion, and I wanted to highlight this opposing opinion. However, the interviews were very limited, and several interviews confirmed the facts concluded from the research results. But still, we're still looking for the opposing opinions. So, to test our results from the previous articles and previous research studies I referred to in this PowerPoint presentation and project. Demographic profile. What's the demographic profile for the city of Flint? According to 2014 census, there are 99,002 Flint residents. There were before that more than 100,000, and they're decreasing. That's interesting. So Flint was ranked the fourth in the U.S. population loss rate between the years of 2000 and 2014. There are younger people in Flint than most of the state's population. The median age of Flint is 35.1. On the other side, the state's median age is 39.6. So, the African American residents consist nearly half of the Flint's population. The young population that we talked about, that's a big profit for the Flint population, that we can use them for better education, better employment, and more resources for the community, by the way. So, socioeconomic factors in Flint, median Flint income is almost half, 52.5% of that of the state. So Flint had the highest poverty rate in Michigan in 2014. So it was 40.1%. 40.1%, that's nearly half of the Flint population is poor. Flint had higher disability rate than the whole state in the period of from 2010 to 2014. And in 2013, Flint occupied the third place in the crime rate after Saginaw and Detroit. Let's talk a little bit about Flint health profile. What are the Flint issues affecting the community? So lead in Flint water has three types of side effects. First, mild side effects, GI side effect, nausea, vomiting, abdominal pains, cramps, constipation, happen to a lot of people. It's misleading. They often missed until we get the more important ones, the neurological side effects like headache, agitation, encephalopathy, foot and rest drop, and coma and death. And in pregnant females, there are stillbirth, miscarriage, fetal maldevelopment, and premature birth. What are the top priority health needs? Children and pregnant females are the most vulnerable. Okay, so we take care more about those two categories of the community. Target should be prioritized by the severity too, other than the age groups and populations. Severity of symptoms starting from agitation, food and rest drop, encephalopathy to coma and death. So going more and more severe symptoms, we should take care according to the severity of symptoms. So we should prioritize. Policy term, mass public education, mandatory that screening for pregnant females and children under 5 years during primary care physician visits. So we need to screen that as any other screening like colonoscopy or mammogram, blood lead level, appropriate management, and therapy. So there are ranges of lead levels in the blood, and according to this range, each range has a certain treatment. So we should go accordingly. We should treat the patient accordingly. Do a regular water lead checkups. So we going forward to the health indicators of the community. What are we need to compare between Flint, top U.S. performance, Michigan, and our target in 2020. So regarding water and air pollution is the highest in Flint, higher than Michigan and top U.S. performers, and we want 100% clean air. That's very difficult to achieve, but we have to reach that target by 2020. We have only drinking water violation in Flint. So and we want 91% clean water. Um, income inequality is highest in Flint. Education, high school graduates are 76%. People who have some college degree 64%. Still, both are lower than our healthy people 2020 target. It's 87%. Unemployment is the highest in Flint, higher than Michigan, and top U.S. performance at 5.8%. We have 9% people uninsured. That's less than Michigan. Ooh, yeah. So, but we need 100%. We need 100% of people insured. So we still have to 9% people to be insured to reach our goal. So we need to prioritize health issue. What are the risk factors for the crisis? Population, children, pregnant females are the most vulnerable, single parent, socioeconomic class, inadequate education, unemployment, water supply change, or water system with no or insufficient anti-corrosion. Contributing factors are race and government issue. Race, African American people are the most vulnerable because they consist nearly half of the population. The government issues, as we referred to before, the releases focus more on expenses rather than the race, and that's a case of environmental injustice. Community resources in Genesee County, manufacturing jobs, especially car manufacturing, dropped from 30% to in 1990 to 9% in 2015. So to make up for this drop, there are promising industries and as construction, professional and health services, business and services, social assistance, leisure, and hospitality. We have this table to summarize the health needs for the Flint community and what we have as resources right now, and if we whether or not we need other resources. So let's talk about the most important problem, the Flint water lead pollution. The government claims that costs of treating water are high, and this is hiding a case of environmental injustice as we talked about before. What are the resources? The resources are the Department of Human and Health Services and Flint Child Health and Development Fund, which founded by Dr. Mona Atisha, and American Academy of Pediatrics too. Those resources are not adequate for sure. We need more attention and resources from the federal government and charity organizations. Access to healthcare is very important because access to healthcare can prevent hospitalization, multiple hospitalization, and unnecessary huge healthcare expenses. What are the resources then? The resources that we have, the Department of Human and Health Services and Catholic Charities. Are those resources adequate? No. 2020 healthy people target is 100%, and we still have 9% people uninsured in Genesee County. Education, the people with higher education have higher paid jobs. So in order to draw more funds, education now is a priority for the Flint city. What are the resources for education? Donations, scholarship, and Department of Education has granted $480,000 to the University of Michigan in Flint in 2016. That's the most recent thing that happened for the education fund. Are those resources adequate? No. In 2020, the healthy people targeted 87%. And as we talked about before, the high school graduates are 76%, and people with some college degree are 64%. Employment is a primary driver of the economy of any community. With better economy, we have better health care. We can treat the Flint water crisis. We can treat any crisis. So, what are the resources available now? The U.S. Department of Labor, manufacturing jobs, although they are few, but still, and promising industries too, as healthcare jobs, business, construction, hospitality. Are those resources adequate? No, because unemployment rate in Genesee County is 5.8%, which is less than the U.S. top performance, 3.3%. That's much less than the top U.S. performance. Limitations of assessment. Our assessment has some limitations, which are very few interview opportunities. Although it was a traffic, that there was no traffic. It was a rush hour, but there is no traffic. No people are in the street. Very few people. There are opposing opinions that took time. Like opposing opinions, they have to be taken into consideration to have a second look at our research study results, and time constraints too of the author. What are the ways to overcome interview limitations? Online interviewing, either synchronous through programs like Skype or asynchronous interviews like through emails. School board posting to attract the parents of the children. We have two main conclusions. Whether some people deny findings or not, there is a noticeable clinical and laboratory findings proving increase in lead poisoning since the water supply shift to Flint River in 2014. Those findings are confirmed by the presence of lead in the water samples from the Flint River. And the Flint crisis is a result of multiple relating conditions, according to the author's view, and other research articles too. That's as economic problems can accentuate it, poverty, poor education, criminal activities, decreasing population year after year. And those are the references here. And thank you so much.